Are you in every way woman?
Everyway Woman presents What's New in Breast Cancer.
Welcome to Everyway Woman. We're talking all things breast cancer and specifically affordable healthcare. One of the most popular or most heard excuses women make is that they can't afford to take care of themselves, and in some cases they can't afford to live. What would you tell these women?
Well, there are a lot of programs out there, and a woman has to be proactive, particularly if they don't have the insurance and they don't have the health care coverage. But almost every community now has resources that they can go to that will screen them with imaging, direct them to get a biopsy. And if they have a cancer, there's state programs that are very comprehensive about providing their care. But women have to be proactive to find these things.
Would you give me that information, Dr. West? Because I don't know where to go. Help me. I don't know where to go. You just told me that I have cancer, or I might have cancer. What do I do? Help me. Where do I get the information from?
Well, if you're with us, we would diagnose the cancer and then put you through the state program that would provide all of your coverage.
What do you mean state program? Is that like Obamacare or?
Actually, it was before Obamacare.
Yeah, it's called the Breast Cancer Cervical Prevention Program. And it's kind of a catchment for people who are diagnosed with breast cancer and don't have insurance. But it's an onerous system. It's a state-run, government-run system, and it takes a lot of paperwork. So we see people that they're in the system, but you have to register, they have to recognize you as a patient before they actually even refer you. So there's long delays in them getting treatment, but it is a treatment option. Another option is Komen. Komen has programs, and there's Komens in every community that will diagnose someone if they have a breast lump. They will actually get them into a provider that works with them through their grants, and they will get them biopsied. And if it's benign, then good for them. And if it's not, then they'll find them the next resource they need, whether they're candidates for the state program.
These excuses are often found specifically in different cultural groups as well. I know we were having a conversation. Anna, you were mentioning.
I'm curious to know, is there anything out there for the Hispanic community? Because a lot of them, there's a language barrier. Right. A lot of, my family members that I may have are too scared to go.
Komen's been very active in Orange County, and we have an outreach program that actually goes door to door, and these women are invited to come in and be screened. In the areas where they've applied this program, they've seen two things. They've seen a high participation rate for a mammography and early detection, the exact combination you'd look for. So as a nation, we can't afford not to diagnose it, because if we diagnose late, the cost could go from $40,000, $50,000 total lifetime cost to $1 million lifetime cost. Well, who's paying for that?
$1 million. That number is astounding to me. I feel like I couldn't afford to take care of myself. I can hardly afford a car.
Wait. So the cost of healthcare is $1 million, or is it worth $1 million? Look, you gotta hold my hand.
Well, I was afraid you might have a seizure or something. I'm checking your pulse.
Wait,
oh my God!
You have to spell it out in Ebonic words for me, because what
Please
does
do.
that mean?
Sometimes if someone's diagnosed with like metastatic breast cancer and they're being treated, because we have great modalities out there, to treat people with metastatic. But
what's metastatic?
Right. When it's spread outside the breast, when it's in distant sites.
So that is like level 4 kind of
stage 4
is what
we call it.
Yeah.
But those modalities are expensive, and it can go on for years. And you have complications because you're on constant treatment, and you get infections, and you're in the intensive care, and so that cost has to get absorbed by someone. So it's always better to diagnose someone earlier. But in terms of the cultural barriers, I think some of it is education, too.
Absolutely education.
And then another thing is, some of these patients aren't empowered. They can't go to whatever resources available because they have to work. They have to bring home a check, because if they don't work, they don't get paid.
And beyond that, though, I talked to some survivors who didn't even feel like they had the authority to even walk into some of these facilities.
Well, because some of these places, let's just keep it real, that it is turned into a Caucasian kind of disease.
Is it because that's all that they see, or that's all that they appeal to?
Because that's what
awareness?
is mainly marketed and promoted, and you don't necessarily see the face of an African American, or a face of an Asian, or a face of a Latina woman. It's mainly just, this is the disease, and it has someone who is Caucasian on it. So a person of color is like, well, I'm not going to go into that place. I'm not going to check on myself because stubborn. Nothing's wrong with me, or they don't have health care, or they're not knowledgeable on where they can get health care.
To your point, though, Emery, what the doctors are saying, that we can no longer use that as an excuse.
Right.
We can no longer use that.
That's what I love about what we're doing today. We have doctors on the panels who are saying, hey, get yourself tested. We have survivors who have said, you know what, irrespective of my financial situation, I got it done.
Right.
And that's what I love about Breastlink and all the education that you can't make. If you don't have money, we'll take money to get a car. We'll get a loan to get a car.
That's true.
We need to do it
Cell
for our health.
phone.
Right.
Right.
Absolutely.
So should you say that we should care more about our health? I mean, should we take that more seriously than
Oh,
the
absolutely.
cars and all this stuff? And
Yeah.
how can we be able to market ourselves in a way where we can go get those checkups? Because when I go to the doctor, I know they tell me, you're too young.
No, but there is no age barrier. Health is a priority. More on Everyway Woman. Stay tuned.
Are you in every way woman?